as I said, I was going to quickly run through some of the work that Lymphoma Australia does, a little bit of a background of the patients and networks that we're trying to help support. So again, for those that missed, I'm a lymphoma care nurse with Lymphoma Australia. And I'll just like a quick rundown of what we're sort of dealing with lymphoma. It doesn't discriminate with age. There's so many different subtypes, but there's over 6,400 patients who were actually diagnosed with lymphoma and CLL last year alone. It's the sixth most common cancer in both men and women. It's the most common cancer in the 15 to 24-year-old, even up to 29-year-old group, and I'm actually an adolescent young adult cancer nurse specialist as well, so it's a high area that I work with that crew, especially with Hodgkin lymphoma. It's the third most common cancer in paediatric setting as well, so hence it doesn't discriminate. But there are over 80 different subtypes, and as the presenters have mentioned today, as they're getting smarter with the genomics and working out the different subtypes and reclassifying a lot of these different lymphomas, we're going to be becoming a lot more. So hence knowing your subtype, and that's what's so important, that they get that your diagnosis correct. And the number, as we mentioned before, is doubling. It's doubled over the last 20 years and slowly increasing for various reasons, we're not sure. So Lymphoma Australia, a lot of our work is obviously providing awareness for the disease in Australia, across Australia, and our CEO Sharon at the back there, Sharon Wilson, she works quite tirelessly, and we're involved in a lot of committees and organisations and speaking with government organisations to make sure that we're on there and having a voice for lymphoma patients across the country. And we're attending a lot of these national meetings, like this is alongside one of the big national meetings, the LLG meetings with all the consultancy this week, and other conferences that are associated with lymphoma across the place. And I'm on a lot of the different advisory committees and supporting nurses on that side of things too. We provide a lot of support, as many of you probably have reached out to us and online. With information, we're slowly improving, increasing the information we're having on our website, and through the phone, so you can call me at any point in time if you have any questions. I can try and definitely get the answer for you if I don't know it, and supporting the nurses who are caring for you as well. We're also an advocacy group. We're trying to help bring the best medications and new treatments and research and clinical trials to Australia, and helping support and letting you know where the best places for your treatment is, and ensuring that best practices across the country. We're collaborating with a lot of other different international organisations too. We're a member of the Lymphoma Coalition, which is a group of patient advocacy groups from right across the world. There's about 60 countries involved, and we're all working together to ensure that we can bring the best treatments to you and the best supports, and knowing where to find that. And obviously education events, days like today, and we're hoping to increase these, and please fill out your evaluation forms today so we know what sort of topics that you're wanting to hear about, okay? We're trying to get across the country and filming events so people can actually see in other areas that don't live in mainly the capital cities. We're trying to get to more rural areas as well. And producing resources which are slowly increasing on through our website as well. So keep your eye out, and let us know if there's something that's not in there that you would like to know. I can always find that information for you. And that information is also dispersed through our newsletters as well. So we're working hard to help improve for people. So we're covering patients from and supporting patients and carers and health professionals from right across the country. So obviously not everyone lives in the capital cities. People live right across in rural areas, regional areas, and we're just trying to make sure that we provide enough information, equity of information support for those patients who aren't always treated in a large lymphoma centre, which are mainly in the capital cities, obviously. And also those who are in private practice, and just making sure that they do know how to access a trial and the best treatments for them across the country too. So working hard with health professionals too. For those who have seen a lot of our resources out the front, you've probably come across with our resources across in various hospitals around the country, and we're slowly infiltrating everywhere. Please let us know if they're not. We can definitely reach out to that hospital. Our fact sheets were slowly increasing over time, and but we're slowly building up in different subtypes, especially some of the rarer subtypes. Some of these lymphomas, as you know, are very rare, and making sure that there's the right information, Australian information for you to be able to get from there. And they can download or print off free offline. And our newsletters we put out every 3 months. There's a patient one, there's also a nurse one as well, with information, anything, updates on lymphoma, patient stories, highlighting a subtype or whatever. Our support line, which is manned Monday to Friday. If I don't answer, please just leave a message. I'll get back to you as soon as I can. I'm quite often things like this, so I'm not always able to answer the phone, but at least you've got someone that, no matter where you live, financial situation or anything, people can contact us from right across the country. And I do get all sorts of questions right through the treatment trajectory from patients and carers, and also health professionals across the country. We're not an emergency line, obviously, so call your medical team if that's the case, but this is access to a lymphoma nurse. Support groups, I'm sure many of you here are a part of the Lymphoma Down Under Facebook group, and it's increasing quite a lot with numbers, and it's a great support line to be able to communicate with other patients across the country, and sometimes international. We only try to keep it through Australia. Then you get support from other patients going through the same situation, and we'll be slowly increasing on that one. It's also moderated by people like myself as well. We just make sure the right information's on there as well, and we'll slowly increase with that too. We're also on all the major social media, Twitter and everything as well, so please hook up to us through those mediums. And there's also local support groups across Australia, which certain patients have also set up in different areas too. So if you're wanting to connect with other people, we can sometimes help connect you in the right place. But being at events such as this and the lunch afterwards, you can all connect and meet other people. So education events, as I said, we're slowly increasing on those throughout. And I mean, this year is probably the biggest year. We're hopefully getting to most capital cities this year and getting out, but obviously we're filming as well so the patients can access these information sessions. International guest speakers, we've got a few coming out this year. We've already had one out this year, so we can also interviewing those doctors as well and getting international feel of what's going on in other places around the world. And webinars, we're really starting to increase on those. I'm hopefully doing a bit of filming over the next 2 days. So again, if there's any patient would love to be able to tell us your story, so you can actually share that story on the website for other patients to see. I'm grabbing a few doctors throughout the next couple of days as well. So that information's on the website for various subtypes and treatments, and we're increasing those. And also symptom management and psychosocial sort of issues too, to help through your journey. So we're slowly increasing with those as well over the next 12 months. For those nurses, a few nurses in the crowd I do know, we do have a special nurse interest group, which now we've got over 600 nurses from across Australia and New Zealand, which is massive. I've started this a little over 12 months ago, and our numbers have just shot up. From a recent patient survey we did a couple of years ago, some of the feedback that patients gave, that they feel that sometimes their haematology nurse or their cancer nurse might not know a lot about their subtype. And the feedback we took from that was, okay, well, maybe we need to go out and educate the nurses across Australia to ensure that they know where to get this information from. So through that, we have a dedicated online portal for those members involved, where they can gather any information about lymphoma. I also have a private Lymphoma Nurses Down Under, so it's very similar name. I've sort of realised it's a bit silly, but nurses can get on there and communicate with each other. I provide a monthly newsletter of all the roundups of publications, videos, any bits of information that I find, and keeping nurses up to date with what's latest in lymphoma, so they can actually share that with their patients. And also a newsletter as well with any updates and new PBS medications and things too. So making it as easy as possible for nurses to be informed and be able to educate their patients is the main objective of that. We've got some wonderful news that Sharon's been working quite hard with this. We've recently had some government funding been announced end of March from Greg Hunt. He's now they've announced the federal funding for the next 4 years for 3 full-time lymphoma nurses. So which is fantastic. So I'll get a few buddies to help me out. And the plan is we're hopefully having some more nurses in each different state, so hopefully increasing the amount of education and support for you, which will be fantastic. We're just in the process of getting that up and going. And I've already mentioned about the webinars, which we're slowly putting out as the months go. We'll let you know if you've signed up for our newsletter. If you haven't already, please sign up, and we can keep you up to date with anything that's been released, education events such as this, and letting you know. I think that's pretty much it. Oh yes, one more thing. For those who haven't already, we've got two different surveys that we've been working with Deloitte, a big company, trying to help us with some strategic direction for Lymphoma Australia. And we've put out a couple of different surveys, one for the patient and carer group, which you can go through our website it only takes about 5-10 minutes, and just gives us an idea, okay, what do you want? What are we missing? What supports can we help improve our services for you? And the same with the nurses as well, and knowing what the nurses want as well, and making sure that we can help achieve any unmet needs throughout both groups. So please do, it'll be really helpful. We've had about a couple hundred patients and carers have done the patient one. The nurse one I've only sort of put out recently, and we're trying to boost numbers there just so I can make sure that I'm targeting the right direction. Yeah, thank you. Is there any questions at all about what we're up to? It's an exciting time and we're keeping pretty busy. No, all good? Ready for lunch? Mm-hmm. Fantastic. Thank you so much for everyone for coming along today. It's been fantastic. I've got a lot out of those sessions. I've definitely learned a lot, so I'm hoping you did as well, and it'd be great to meet a few of you over the lunch break. So thank you.